Hello, my name is Josh, and I did my project on Gigeorge syndrome. The reason I chose this topic is because of my cousin Eddie. Gigeorge syndrome is also known as deletion syndrome and is caused by a defect in chromosome 22. Medical problems commonly associated with Gigeorge syndrome include heart defects, poor immune system function, complications related to low levels of calcium in the blood, and delayed development with behavioral and emotional problems. Here are some frequent symptoms of Gigeorge syndrome. Frequent infections. Certain facial features such as an underdeveloped chin, low set ears, white set eyes, or a narrow groove in the upper lip. A gap in the roof or the mouth, or other problems with the palate. Delayed growth. Difficulty feeding and gastrointestinal problems. Failure to gain weight. Poor muscle tone. Delayed development such as delays in rolling over, sitting up, or other infant milestones. Gigeorge syndrome is also caused by the deletion of a portion of chromosome 22. Each person has 2 copies of chromosome 22, one inherited from each parent. If a person has Gigeorge syndrome, one copy of chromosome 22 is a missing segment that includes an estimated 30 to 40 genes. The deletion of genes from chromosome 22 usually occurs in a random event in the father's sperm, in the mother's egg, or it may occur early during fetal development. Rarely, the deletion is also inherited condition passed to a child from a parent who also has deletions in chromosome 22, but may or may not have symptoms. Some complications of the disorder include the following: heart defects, low calcium levels in the body, little to no immune system, distinct facial features, learning, behavioral, and mental health problems, autoimmune disorders, or increased chances of disease. Although there is no cure for Gigeorge syndrome, treatments can usually correct critical problems such as a heart defect or low calcium levels. Treatments include certain drugs in order to keep things the body needs at a good level. In some cases, Gigeorge syndrome may be passed from an affected parent to a child. That's really the only way to prevent it. There is no way. Yay? Thank you all for watching. The sources I used were mayoclinic.org and my family. Eddie has had an amazing life so far, meaning his hero Shaq, in which Shaq gave Eddie his own shoes. My family loves him, and he loves us, and we are hoping he continues to live an amazing life. Thank you all.